Well, good afternoon, everybody, and thank you for joining today's briefing. As of today, we have had 1,273,623 COVID cases. 1,273,623 COVID cases. 6,290 new cases reported since yesterday. 3,815 people in the hospital, and 3,815 people in the hospital, and 15,004 people who've died. Sadly, most all of the COVID deaths that are now occurring are preventable. The COVID deaths that are now occurring are preventable with a safe, easy, free vaccine. And I want to thank the millions of North Carolinians who've stepped up to get one. But we need more people to get vaccinated. How many more people have to get sick and die because people don't get this miraculous, God-given, effective, and extraordinarily safe vaccine? How many more people will have to witness the painful, cruel death of a loved one to finally see that vaccines are the way out of this? Today, Dr. Mandy Cohen, our Secretary of the North Carolina Department of Health and Human Service, will walk through the data to show our statewide COVID trends. The numbers aren't good, especially the number of people in the hospital and dying. We can't stress enough. By far, the most people hospitalized by COVID right now are unvaccinated. For the most part, ending up in the hospital because of COVID is largely preventable. COVID-19 vaccines are continuing to do their job by stopping most of the severe illness and death among those who've had their shots. And they remain our best tool to end this pandemic. And remember, these safe and effective vaccines are available all across our state, regardless of whether you have health insurance. They are absolutely free. If you're still unsure about getting one, how about get off social media and get on the phone with your doctor? That's the best place for accurate medical information. While vaccines are the best protection from COVID-19, effective treatment is also available if you do get infected. If you test positive and have mild to moderate symptoms, I encourage you to talk with your doctor about the treatment of monoclonal antibodies. They've been shown to be effective at preventing hospitalization and severe illness once you already have COVID. This shows how important it is to get a COVID test, because this treatment has to be administered within 10 days from the start of symptoms. And of course, your doctor will make the final decision on whether monoclonal antibody treatment is right for you. Last week I signed an executive order to make it easier to get monoclonal antibody treatment by increasing the number of places that you can get it around the state. North Carolina is also working with FEMA to set up several sites where this treatment will be administered. We hope that by preventing COVID-positive patients from developing more severe illness, we could save lives and take some of the strain off our hospitals. Now I'd like to ask Dr. Cohen to present our data and provide other updates. Dr. Cohen. To present our data and provide other updates. Dr. Cohen.
Thank you, Governor. Before we jump into the data, I wanted to take a moment to express, my deep gratitude to all our healthcare workers. They put those shots in arms, swab noses for tests, administer the monoclonal antibody treatment the governor mentioned, and care for the many people in our hospitals. So much has been asked of our healthcare workforce, and yet they continue to give. Thank you. Thank you. One way we can all show our appreciation and lift some of the burden off of our healthcare providers is by getting vaccinated now. Okay, let's dive in and take a look at the data. This first graph looks at people who come to the emergency department with COVID-like symptoms. It's our earliest detection mechanism, and you can see when looking at that yellow line, it rose dramatically through July and August. However, if you look at that far right, there may be a glimmer of positive news. For the first time since this summer, the line looks to be leveling. Next, we look at COVID cases. This first graph shows you the trajectory of new cases. This first graph shows you the trajectory of new cases each day since we had our first case back in March of 2020. The peak in the middle of the graph is back in January of this year before vaccines were widely available. Now, I want you to look to the right of the graph and notice how steep that yellow line is in recent weeks. This summer, we have experienced the fastest rise in cases since the pandemic started. Let's zoom in and look at just the last few weeks in terms of new cases. So on this graph, we're looking at cases from early July through today, and you can see that our cases remain high, and we are now averaging about 6,000 new COVID cases each and every day for the past week. This rapid increase is because of the Delta variant of COVID-19, which spreads much more easily than the original virus. And it's leaving unvaccinated people very vulnerable. Our case rates are highest for children 17 and younger. For the week ending September 4th, they made up almost a third of the state's new COVID-19 cases. That's the highest percentage since the pandemic began. We've seen some good news in terms of cases when it comes to our long-term care facilities. With more than 80% of most residents vaccinated, fewer of those residents are testing positive for COVID-19 even when there's an outbreak. All right, so next we're going to look at the percent of tests that are positive. We're going to look at the percent of tests that are positive. This graph also goes back to early July, and looking at the yellow line, our percent of positive tests has been of 10% since the beginning of August, and that's well above our 5% goal. As the governor mentioned, anyone who has symptoms of COVID or has been exposed to COVID should get a test as soon as possible. We have a treatment that must be given within 10 days of your first COVID symptoms. So getting tested early is really important. While vaccines are our best protection from COVID, the treatment, this monoclonal antibody therapy may reduce the risk of going to the hospital or for getting severe symptoms. And in good news, we saw 73% increase in monoclonal symptoms. And in good news, we saw 73% increase in monoclonal antibody administrations during the last week of August compared to the week prior. And you can learn more about monoclonal antibodies at COVID-19 week prior. And you can learn more about monoclonal antibodies at covid19.ncdhs.gov/treatment. Now on our next graph, we look at day-over-day hospitalizations. This graph also starts in early hospitalizations. This graph also starts in early July, and this trend is one of our most worrisome metrics. You can see, looking at the yellow line, that this trend has increased rapidly. Today, we have more than 3,800 people in the hospital for COVID, and we are closing in on 2 straight weeks with more than 900 North Carolinians requiring an ICU or an intensive care unit bed. This is the most we've seen since the pandemic has started. And now it's important to note that a third of the people who are hospitalized right now with COVID are under the age of 49. Our hospitals are strained. Hospital leaders, 49. Our hospitals are strained. Hospital leaders, doctors, and nurses are pleading with people, please get vaccinated, to not only protect yourself from COVID-19, but to help make sure that the hospital care is there for people who need it, whether it's someone who has COVID or needing cancer treatment, a heart attack, or a life-threatening health crisis treatment. This next slide looks at what's happening at the local health crisis treatment. This next slide looks at what's happening at the local level. This is a map from the CDC that shows the level of community viral transmission here in our state. And as you can see, all North Carolina counties are red with high levels of viral transmission. That means everyone in North Carolina should be following the CDC guidance and wearing a mask indoors in public settings until more people are vaccinated. And viral transmission decreases to moderate or low levels. All schools should be requiring masks to keep everyone in school for in-person learning. Okay, so now let's look at our statistics around vaccination. Today, 59% of North Carolinians ages 12 and older are fully vaccinated. 59% of North Carolinians ages 12 and older are fully vaccinated. 62% of those 18 and older are fully vaccinated, and 86% of those 65 and older are fully vaccinated. And I want to thank the millions of those 65 and older are fully vaccinated. And I want to thank the millions of North Carolinians who have already been vaccinated and are protecting themselves, their communities, and our children who cannot yet get vaccinated. On our last slide here, it shows the percent of population who are population who are fully vaccinated by age groups. And here you can see only 35% of children by age groups. And here you can see only 35% of children ages 12 to 17 are vaccinated, and only 40% of young people ages 18 to 24 are vaccinated. Now, I encourage teens to visit TeenVax24 are vaccinated. Now, I encourage teens to visit teenvaxfacts.com to get information and resources they need to educate themselves about COVID-19 vaccines. We're also working to make it easy and COVID-19 vaccines. We're also working to make it easy and hopefully fun as possible for young people to get their shot. Now through September 12th, you can get your shot at Carowinds. They're giving people who get 12th, you can get your shot at Carowinds. They're giving people who get vaccinated there a free ticket to their Winter Fest event. With hospital capacity severely strained, we remain at a critical point in the pandemic. To slow the spread of COVID-19 and protect ourselves and others, we strongly recommend that you add layers of protection. Obviously, get vaccinated. Layers of protection. Obviously, get vaccinated. Wear a mask when you're indoors in public settings. Get tested if you have an exposure or you have symptoms of COVID, and then seek treatment early. And then seek treatment early for COVID. And I want to thank again everyone who is doing everything they can to help us get through this moment and protect one another. Please talk with your family and friends who are not yet vaccinated. Help them to get accurate information and urge them to get their shot now. Ask them to join you and urge them to get their shot now. Ask them to join you in vaxxing up and masking up. Thank you, Governor.
Thanks, Dr. Cohen. We are 18 months into this pandemic and almost 9 months into the time vaccines have come on the scene. These infection rates, hospitalizations, and deaths are not what we want to be seeing. The key to ending this pandemic, of course, is the vaccine. There's still time to protect yourself. And we all need to do our part to get the shot and talk with our friends and family who are still hesitant. At the beginning of this month, as per my executive order, state cabinet agencies have started requiring state employees to verify that they have been vaccinated, with the consequences of weekly testing and required masking for not doing so. And I'm encouraged to see that many businesses in our state are also setting a strong example by requiring vaccines for their employees and their customers too. This protects them from getting sick. And it also protects our economy by keeping stores and businesses open and encouraging customers to come while preventing the harmful impacts of COVID. I encourage more businesses to step up and do this. The more places you need a vaccine, the more vaccinations we'll have. The more people who get their shots, the more we're protecting our children in schools, especially those who aren't old enough to be vaccinated. Especially those who aren't old enough to be vaccinated. The first few weeks of school have brought excitement for children across the state as they return to their classrooms, their teachers, and their friends. But we know the first weeks of school have also teachers and their friends. But we know the first weeks of school have also brought more COVID cases among school children, which have led to some quarantines. This has been and will continue to be especially true when schools don't have strong mask requirements in place. At the time of our last COVID press briefing, 74 school districts covering roughly 64% of our children statewide were requiring masks. Today, we have 109 districts covering more than 96% of children with mandatory masks. That's a remarkable increase. I'm glad so many districts have worked with our state health officials and their local health departments to protect their students and their staff. In order to keep our children in the classroom in person, I urge school districts to keep mask requirements and other important safety measures in place as we continue battling this pandemic. I also encourage school districts to take advantage of the free testing that's being offered. These tests can be used in schools to diagnose students with symptoms or even screen students and staff to catch COVID infections before they spread. We know that keeping kids learning in the classroom is the most important thing for our students right now. Getting vaccinated, wearing a mask in public indoor settings, and following the science is what we all need to do. The faster we put this pandemic behind us, the sooner we can all rest easy and stay healthy. Also with me today is our North Carolina Director of Emergency Management, Will Ray. Monica McGee and Lee Williamson are our sign language interpreters. And behind the scenes, Jackie and Jasmine Mativier are our Spanish language interpreters. I know we have some reporters here in the room, and we'll recognize them first, and then we'll go to people who are on the phone. Yes, Brian.
Hey, Governor. Brian Anderson here with the AP. I had one for Dr. Cohen first and then two quick for you. Anderson here with the AP. I had one for Dr. Cohen first and then two quick for you. Can you just sort of explain what the current policy is on virtual learning in North Carolina and what the thought process was back on July 21st when that requirement for virtual learning in districts was removed?
Yeah, thanks, Brian, for that question. So in our Strong Schools Toolkit, there are protocols in there to make sure that our students can be in the classroom learning safely. We know that in-person learning is so important for our students, and we now know so much more about how we can keep them safe and in the classroom. So our school toolkit really focuses on ways to keep kids in the classroom. So it certainly It really focuses on ways to keep kids in the classroom. So it certainly is saying things like schools must require masks, particularly with this level of viral spread. And we're glad to see nearly every school district in the state has heeded that advice. Every school district in the state has heeded that advice and now have mask mandates, all but three districts. So I think they're heading in the right direction, and we're protecting our students so they can be in person for learning, and so that we can cut down on kids being out of the classroom for any quarantine kind of purpose. So our focus has been to keep kids in the classroom for any quarantine kind of purpose. So our focus has been to keep kids in the classroom and keep them there safely. Thank you.
I had a couple for Governor really quick. I've spoken with parents in Union County where last week 1 in 8 kids were under quarantine. That's one of those 3 districts in the vast minority that is not requiring masking. As a result, longer quarantine periods. But because there's no requirement for districts to offer a virtual learning option as they had in the spring, this is causing tens of thousands of hours of learning loss. And I've talked to parents who said they've sent you emails and have called on a petition for you to step in. Just what's your response to them?
Well, certainly I will look into that. I'm not sure that with the state law as it is now, that you can put in a virtual learning option, but I will look at that and look into that request. On mask requirements, what we have found here is that when local boards of education, superintendents, principals, and teachers are educated about the science about this, and they have to make the decision on local mask requirements. We have found that to be more effective. We have found that to be more effective. We have found for enforcement and compliance to be more effective. And that's why we're working so closely with them, providing health information to them about it. I hope that Union County, I know it was a close vote, I hope they will change their mind on this and move to a mandatory mask mandate there in order to protect students. We have more than 96% of our students covered, and we'll continue working with them.
And there's only 3 holdouts, and more than 4 dozen have already reversed course, and 98% are covered now under the mask mandate. But having said that, there's still these 3 holdouts, and one of them is the 6th largest school district in the state. What do you say to parents right now who just want to get their kids back in a classroom? What leverage does the state have in kind of forcing the board's hands if that's the option you guys want to go?
So all options remain on the table for us. What we're doing now is working closely with our local school boards and our superintendents to keep our students safe. And so far, that has been the most effective, and we'll continue. Working with Union County and other counties to make sure students are as safe as possible.
Thank you.
Yes, Dawn.
Hi, Dawn Bonner with the News and Observer.
Thank you.
Yes, Dawn.
Hi, Dawn Vaughn with the News and Observer. Kind of going off of Brian's question about the masks in schools with the, city of Raleigh has the mask ordinance and other cities do. Is that something that you want ordinance and other cities do? Is that something that you want to keep leaving up to the local governments, or is there any consideration on bringing back an indoor mandate statewide?
So we are laser focused.
Back an indoor mandate statewide.
So we are laser focused on getting people vaccinated. We are spending a lot of our time encouraging businesses, working on our state employee, requirement of vaccinations, making sure that vaccinations are available all across our state. It's pretty clear all across our state. It's pretty clear that people know that it's important to wear a mask indoors. The CDC has been recommending it. We have been recommending it. We encourage local governments to put mandates in place. We encourage We encourage businesses that when their customers come in, we think they're going to get more business if they require people to wear masks, because people will feel safer when they go in. But we're going to continue working with them. All options will remain on the table. But right now I think we're doing the things and using our authority in the most effective way, like waiving regulations to get more vaccinations out, to move monoclonal antibodies in different places across the state. And I think that what we've done so far is the most effective use of the governor's authority in this situation.
Other states have required teachers to be vaccinated. Is that something that you would consider statewide? I know you've been asked this before and said at the local level for that. Is that something you still think should be at the local? And said at the local level for that. Is that something you still think should be at the local level as far as any requirement for vaccinations for teachers?
Again, I will say that all options remain on the table. One of the reasons that we moved teachers up in the vaccination priority is because we knew it was important for them to get it. And right now we moved to have state employees and cabinet agencies required to verify that they've been vaccinated. I hope that local school systems will move toward this. I hope more teachers will understand that it's really important to protect their students. For them to get vaccinated is also important. It is also important to protect themselves.
A question for Dr. Cohen. There have been public complaints. A question for Dr. Cohen. There have been public complaints about large college football games with everyone outside. Is there any concern with masks outside, or is that not as much of a factor? Because it's outside?
Well, we know that this virus spreads more easily when you are indoors in close contact for a longer period of time. So outside the risks are lower, but they're not zero. This virus can still spread outside. So we are focusing our attention really on making sure folks, when they're inside, that they're wearing masks all the time. When you're outdoors, we still recommend that you think about layers of protection. Vaccine still is going to be the thing that's going to protect most of us most of the time, and that's why the governor, myself, the thing that's going to protect most of us most of the time. And that's why the governor and myself, we're spending our time talking about vaccines and why they're so important. But layers of protection are important here, as I mentioned. Thinking about wearing a mask, particularly if you're doing an outdoor event, thinking about wearing a mask, particularly if you're doing an outdoor event with a lot of people, or if the activity itself is more risky. So if you're doing something where you are shouting, singing, where you're doing a lot something where you are shouting, singing, where you're doing a lot more heavy breathing, those are the times where you're going to want to wear a mask, because risk can increase in that case. So get vaccinated. Absolutely, everyone needs to get vaccinated as soon as possible. Wearing a mask indoors for everyone needs to get vaccinated as soon as possible. Wearing a mask indoors for everyone, of course. And then when you are outside, there are still risks. So if you are in a setting with a lot of people, or you're doing a higher risk activity, to wear a mask. In a setting with a lot of people, or you're doing a higher risk activity, to wear a mask outdoors as well.
Do you think there should be rules around it, or it be up to the individual choosing what their risk factor is?
Well, I think we've all learned a lot about the 3 Ws. I think everyone's heard us say it so many times. They still apply here. A lot about the 3 Ws. I think everyone's heard us say it so many times. They still apply here. And so we're going to continue to encourage folks to think about their own risk and what they're doing, and to wear masks to protect themselves and others. Thank you. To wear masks to protect themselves and others. Thank you.
Hi, Governor. I'll just start on the same thing. First of all, are you planning to go in any? First of all, are you planning to go in any college football games?
I may very well, but I'll tell you, this vaccination effort we're putting on is keeping me pretty busy. But I'll watch them on TV.
Are you going to go to the fair?
I may very well go to the fair on TV.
Are you going to go to the fair?
I may very well go to the fair. I usually go every year, so I plan to do that.
So with all these things coming up, COVID is not going to deter you from coming to these events?
No, it won't. I'll tell you what, though.
Deter you from coming to these events?
No, it won't. I'll tell you what, though. If I go, I'm going to be careful. And if I'm around a lot of people, even outside, I'm going to have a mask on. And I'm not immunocompromised. I think everybody has a mask on. And I'm not immunocompromised. I think everybody has to look at their own situation and make decisions for themselves. Particularly people who have not gotten a vaccination. This is a real problem for them to have not gotten a vaccination. This is a real problem for them to be out in large crowds and to be in places where they are not wearing masks. People who are vaccinated certainly are better protected there.
We've been here before, and you've said that all options remain on the table. I guess my question is, what are you waiting for? Because for 18 months, at least 18 months ago, the talk was we're doing all these restrictions, the executive orders about flattening the curve. There's no flat curve. In fact, it's kind of out of control now, and the hospitals are overwhelmed. We're seeing things now that we haven't seen in many months. So if the whole idea of the restrictions were to flatten the curve, and now there's a huge curve, why not bring back restrictions? Why not bring back restrictions?
18 months ago, we did not have vaccines. Now we do. Now many more people across our state are protected from this virus, and we're getting more and more people vaccinated every day. That's what's going to work. That's where we're going to continue every day. That's what's going to work. That's where we're going to continue to be laser focused. And we also want to do things that people are going to pay attention to and that people are going to obey. and that people are going to obey. And I think it's important that we not put things into place that's going to detract from the effort to get more people vaccinated, which is what we want to do right now. We want to have everybody coming together, businesses and others, to step up, and we're seeing more and more people, other businesses and others, to step up, and we're seeing more and more people to do that.
One of the things that we learned about vaccinations was the low rate among the teenagers, or the tweens and teens, 12 to 17. I'm sure teenagers, or the tweens and teens, 12 to 17. I'm sure you'd like to think they're watching right now. They're in school. I'd like to think they watch the news or read the news. They probably don't. So what's the game plan for actually reaching that segment of the population?
You know, it's really important. It's one of the reasons.
Game plan for actually reaching that segment of the population.
You know, it's really important. It's one of the reasons why we've been working with schools, with universities, to get the message out that young people need to get vaccinated. Dr. Cohen, you may talk a little bit about some of the efforts the department is undertaking.
Thanks, Governor. And thanks, Jonah, for the question. Yes, we are wanting to very much reach a teenage. Thanks, Jonah, for the question. Yes, we are wanting to very much reach a teenage audience. Just a couple weeks ago, I was doing a fireside chat with some TikTok influencers. We have our Teen Vax Facts, and we have partnerships like, as I mentioned, with Carowinds, Teen Vax Facts, and we have partnerships like, as I mentioned, with Carowinds and others who I know are reaching our young adults and our teenagers, because we want them to understand this for themselves, understand why getting vaccinated isn't just about them. It is really about their community and about their family, their friends, maybe their grandparents, and continuing to protect everyone. So we want them to get their own good information, make sure they know where that is. So we're trying to make sure we're reaching them where they are, probably not on this news program, like I said, but on whether it's the social media platforms or in the places in which they are gathering. So we're trying to reach them. I did want to address forms or in the places in which they are gathering. So we're trying to reach them. I did want to address, if I could, just one other thing in one of your earlier questions. You know, I want to praise our healthcare workers again, and particularly our hospital systems who are strained, but I would not call them overwhelmed. And it's because I think of the collaborative partnership between the hospitals that I think that we have been able to respond to this pandemic so well, that they've been able to continue to take in patients, that anyone who needs a hospital bed and see a doctor and a nurse is going to have one. I think we need to keep up this effort of making sure people get treatment and vaccines, and all of the efforts. But I do want to say I'm very proud of the work that the hospital systems are doing to make sure that they remained strained but not overwhelmed, so that we can care for folks. Thanks.
Thank you.
Thanks.
Thank you for your patience, and thank Michael. I still have more. About hospitalizations. Yes, it's really, either one, who knows? I still have more. About hospitalizations. Yes, it's really, either one, who knows? It's really annoying that we have these quarantines in school. I'm sure it's annoying for the students, the parents, the teachers, but are these kids going to it's annoying for the students, the parents, the teachers, but are these kids going to the hospital? We have all these clusters. Are they going to the hospital, or are, thank God, we just have a lot of kids that are getting sick, which happens in school when there's not COVID. We have a lot of kids that are getting sick, which happens in school when there's not COVID. So what do we know about that?
I'll let Dr. Cohen address this specifically, but we know more and more of our children are going to the hospital, and that's deeply concerning. and more of our children are going to the hospital, and that's deeply concerning. But go ahead.
Thanks, Governor. So first, a couple of things. About quarantine itself with our students. So we already know that if there is our students. So we already know that if there is an exposure, but both of the students or the teacher and the student are both wearing masks, then quarantine is not necessary, so that is good. Though we are seeing more viral spread in those, so that is good. Though we are seeing more viral spread in those under the age of 17. As I said, for the first time, a third of our cases were in our children who are under 17, and we are seeing more cases go to the hospital. It's still, luckily, 17, and we are seeing more cases go to the hospital. It's still, luckily, a small percentage of our overall hospitalizations are children, but we are definitely seeing more children in the needing ICU level care, and it's particularly those children that likely have some underlying medical conditions in addition, asthma or other severe types of medical conditions. When they get COVID in addition, it does make them make them quite sick. As always, COVID luckily has not been as severe for our kids as it has been for our adults. But when we just see the amount of viral spread where there has been for our adults, we're going to see more kids get sick, more kids unfortunately get severely sick. And so what we all need to do is work together to make sure we can get less virus circulating around, and the best way to do that is for us all to get vaccinated.
Thanks. Belated good yontif.
Michael?
Hi, Governor. We've seen reports today that President Biden is going...
Michael?
Hi, Governor. We've seen reports today that President Biden is going to be mandating vaccinations for federal workers without the testing option. Are you considering doing the same thing for state employees under your authority, or are you going to stick with the current policy?
Well, first, I'm glad to see
For state employees under your authority, or are you going to stick with the current policy?
Well, first, I'm glad to see the president making this requirement for federal employees. It's going to take at least 45 days for them to ramp up to set up the verification process, which we have been doing now for weeks, to be able to know who is vaccinated, who is not, whether there is a medical or religious exemption, and putting all of that into place. We want to see how this works. We believe that this is getting more state employees. We believe that this is getting more state employees to step up and get vaccinated. So we'll look at what the feds do over the next couple of months, because it's going to take them a while to ramp up, and we'll see how effective our verification requirement is for state employees. The idea is to get more shots in arms, but right now, since our state verification requirement has just taken effect, we want to see how this works and continue to encourage people to get vaccinated.
So no plans imminently, at least, to make any changes?
Not at this point, no, not at this point.
So no plans imminently, at least, to make any changes?
Not at this point, no, not at this point.
Do you all know yet what percentage of state employees under your authority are vaccinated?
We don't know yet, but we'll be able to provide that to you in a week or so, because right now state agencies are downloading their information. I think the system went live on September the 4th, but a lot of that information is being gathered. And we'll have a report in a week or so about how many state employees have verified that they've been vaccinated and where we are with that situation.
And then one last question I have.
They've been vaccinated and where we are with that situation.
And one last question I had was related to the incentives that the state was offering previously to get vaccinated. The one I heard the most positive feedback about was the cash card program, particularly that it helped people to take time off work, pay for childcare. Are you considering bringing that back, since there were people who did want to take advantage of it?
We may very well. Dr. Cohen, you want to talk about that?
Thanks, Michael. We did sunset the program as of the end of August, but yes, we have heard that has helped and motivated folks. But also, we recognize that to get your vaccine you have to take time off of work, and when you're not at work, for a lot of folks, they're not getting paid and they need transportation costs. So we recognize that there is a value add there. So we definitely think we will have pockets of where that will be available. Unclear if it's going to be across the whole state or just in certain places. We're looking at that right now. Thanks.
Adam?
Yeah, Adam Owens, WRAL News. You mentioned earlier, Governor, that there is increased concern that the youngest among us are starting to more and more show COVID sickness. What level is that concern, and do parents need to be? We're starting to see it pick up now. Do parents need to prepare themselves that we will continue to see an increase in COVID in our children?
Dr. Cohen, I'm going to let you address that.
So a couple of things I would say about COVID and our kids. First, as we've always seen, luckily COVID seems to be less severe in our children than it is in our adults. However, there is a lot of virus circulating in our state, and this is really going to those who are unvaccinated. And we know that every child under the age of 12 is unvaccinated. And I showed some data earlier about our lowest vaccine rates are in our 12 to 17-year-old, right? So our kids are the most unvaccinated. This virus is seeking out the unvaccinated. So we are seeing a lot more cases in those that are 17 and under. But again, they are often less severe cases, but there is always a spectrum, right? There are going to be cases where some kids have a very simple cold and other kids get really sick. And it's not always clear which kid is going to fall into what category. And that's why we all have to work together to make sure that we're lowering that rate of viral spread. We're all getting vaccinated. We're all wearing masks, doing the things that we need to do. I will say, as a parent of two children who are unvaccinated, I have a 7 and a 9-year-old. They also go to the Wake County schools. I feel good about them going to in-person school when we are using those safety protocols. So as a mom, as a doctor, as the public health lead for the state of North Carolina, I feel very good about that we are doing what we need to when our schools are following those safety protocols, that our kids can be in-person learning, can be safe, and can be protected. But we all need to work together to get this level of virus down in North Carolina. It's way too high, and we all have to get vaccinated and work together. Thank you.
Dr. Cohen, it doesn't take much, it appears, for these cases to overwhelm the pediatric ICU numbers we have. I was talking to some hospitals today who say that there have been times and we have a lot of really big hospitals in this area, there have been times where the pediatric ICU number of beds in all of the triangle have been maybe just a couple. What are your concerns there?
Well, I think that speaks to the fact we know that kids get sick less often overall from all types of viruses and illnesses, so there are just less pediatric-focused intensive care resources in our state and in every state. And so when we see something that is traveling around our children and are making them sick, we know we're going to be utilizing those resources and potentially putting a strain on it. And I think that's why you're hearing our message today to say we have to work together on this. Adults getting vaccinated directly helps our children who cannot get vaccinated right now. And I think that's what we're trying to articulate today. We're all in this together, so our actions are helping to protect our kids who can't. So whether it's getting vaccinated, wearing your mask indoors, and protecting each other, I think that's what we all are focused on, because this virus is very contagious, it is serious, and we need to make sure that we're protecting each other. Thank you.
We'll now go to the phone. Have the first question.
Our first question is from Vanessa Rufus with WCNC. Hi, thank you so much for taking my question. I wanted to see if I could revisit some of the prior questions that we talked about with Union County schools and their decision thus far to not mandate masks in the classroom. I was just curious to see specifically how you plan to continue to work with those districts. I mean, other than, I think you had mentioned trying to put out more education, but is there anything else that you're doing to try to convince districts on their own to put masks in the classroom?
Well, one of the things that I think some of these districts who did not have mask mandates are finding out is that they have a higher level of the spread of the virus, and more quarantining occurs, and therefore children are not in school in person as we want. And a number of those counties have gone to a mandatory mask mandate because of those issues. We don't want to see that in any county across North Carolina, but we're going to continue to work with their public health director, with these school boards. We have a toolkit that provides a lot of safety measures, not just masking, but a lot of other safety measures. For example, they could, in these counties, require more screening testing. They've got a number of tests that they can use to screen students to make sure that we slow the spread by getting positive students and staff out of the schools. So there's a lot we're going to continue to do together to continue to get people vaccinated and to work toward getting through this pandemic. Next question.
Our next question is from Richard Craver with the Winston-Salem Journal.
Yes, Governor, this is Richard Craver with the Winston-Salem Journal. I had a couple questions for you. One is, where do you stand on the legislation involving the North Carolina High School Athletic Association? The bill is now cleared to Senate, and your expectations of that. And then the second, the legislation involving your executive authority during an emergency.
Well, first, it's important for our high schools to have athletics and that they be properly regulated. I do have concerns with the bill in dismantling what is in place now. I will look at this legislation. I haven't seen the latest version of it. I know that I think it still has to go through the House. I will be glad to work with the legislature on it, and as it goes through the process, I will consider it. For emergency authority of the governor, I think that we are seeing this in action right now, and things that we're doing to get vaccinations to people more easily and getting COVID treatments to people more easily. I think this is important emergency authority to have in a public health crisis. And when you look at North Carolina overall, a few months ago, the CDC, the Bureau of Labor Statistics, put out 2 graphs showing that North Carolina was among the lowest states in COVID deaths per capita and among the lowest states in job loss per capita. I think the steps that we've taken for this state are positive to protect the health and safety of North Carolinians. Things change very quickly during this pandemic. So I think that authority is important and will continue to be as we fight this virus. Next question.
Our next question is from Derek Dellinger with Fox 46.
Thank you for taking my question. This is Derek Dellinger with Fox 46. Following up a little bit on Jonah's question from a little bit earlier, We heard from some local governments, also some school districts, who say the onus should not be on them to be making some of these decisions because people are traveling outside the counties, outside the districts for masking. To those governments, to those municipalities, to those governing bodies, what do you have to say to them to basically say, hey, you should be doing this and not us?
Well, we have provided the school systems with a toolkit, and we have strongly recommended everything that is in that toolkit. And when school boards, superintendents, faculty have to take the time to understand it and to consider it, we've seen more effective enforcement of the things that are in the toolkit. So I think it's important. Yes, there needs to be statewide authority, and we need to use that judiciously, and sometimes it's appropriate to use it all across the state. But throughout this pandemic, we have encouraged local governments to step up and do the things that they need to do, and sometimes doing even more than what the state requires. And we want to continue that relationship with them, providing them with information and letting them make decisions at the local level. Next question.
Our next question is from Rose Hoban with North Carolina Health News.
Governor, Dr. Cohen, thanks for taking our question. We've been hearing from people that it's harder to find testing. And you were talking about getting people tested more readily so they can take advantage of the monoclonal antibodies. You're standing up sites for the monoclonal antibodies. What about sites for testing? What are some of the resources that you're going to be bringing to bear?
We are doing that, and in fact, a number of the hospitals and emergency departments have told us that people are often going there for testing, and we know that they are burdened now with sick people who are coming in. So we have worked to set up special clinics and places people can go to get tested, and I know Dr. Cohen has more specifics on that, so I'll let her address it.
Hi, Rose. And just to let everyone know that if you need a COVID test, you can go to our website. There is a tool that allows you to find testing locations. Certain ones are put on by the state and are completely free. Others there are thousands of them across the state of North Carolina. And we are doing an enormous amount of testing in these testing sites, some of the highest amount of testing that we've done. I think it is why we're at a different moment in this pandemic than we were even a year ago. Our ability to do an enormous amount of tests each and every day with fast turnaround times continues. I'm really grateful for the partnership with a lot of our labs that have really built up their capacity and can even handle more capacity to do lab tests, which is great. I'd also mention that there are different testing modalities available. So you can get home testing right now. You can order them free from us. Again, go to the DHHS website and you can find out more information about free home testing as well. So there's lots of different options for folks to get availability of testing. You can purchase testing again for home as well. So we encourage everyone to take advantage of testing as another layer of protection. Again, vaccines most important, masks indoors, testing if you've been exposed or have symptoms, and making sure that you get treatment early. Thank you.
Next question, please.
Follow-up, Rose Hoban, North Carolina Health News.
You folks, we were talking about schools and kids, having to go into quarantine and whatnot. Are you making rapid tests available at schools? And what are the average turnaround times for PCR tests right now? I saw that in the past week they've kind of gone up.
Yes, rapid tests are available for schools, and most of them are using them now. And in fact, we're encouraging them to use more rapid tests, not only just for symptomatic students and teachers, but also as a screening tool. I'll let Dr. Cohen address the PCR turnaround issue.
Hi, Rose. I didn't look at that data today, but when I looked at it yesterday, our turnaround testing times have really had steady about 1.5 days for a full lab PCR test for turnaround times. Of course, over a holiday weekend like Labor Day, that does inch up a little bit over a holiday weekend, but we're sort of back down. And again, I've talked with some of our laboratory partners who say they have capacity to do even more. So we don't expect that our test turnaround times are going to be affected anytime soon. And we know that there's a lot of different types of testing going on. We want to just make sure folks have access to tests as an important tool in fighting this virus. Thanks.
Next question.
Our final question that will conclude today's media briefing is from Laura Lee with Carolina Public Press.
Good afternoon, Governor. My questions are about boosters. So the initial plan was for boosters to come September 20th, and now we know the FDA will consider it on the 17th, and it may only be for Pfizer recipients. I'm just wondering, what do you know about when and how boosters will be offered for North Carolinians who want them?
Well, first, we're already providing third shots for immunocompromised people, and those are being given right now across North Carolina. We are ready for third shots with Pfizer whenever they are approved by FDA and CDC, and we know that there are going to be meetings over the weekend. We know that it could come as soon as September the 20th. We're still unsure as to whether you had to have had your last shot 6 months or 7 months or 8 months. I'm not sure we know yet. Maybe Dr. Cohen has found out something in the last day or so that I don't know. But we will be ready. Our providers will be ready for those third Pfizer shots for people when approval is given. Dr. Cohen, she says that does it. Next question.
Follow-up, Laura Lee, Carolina Public Press.
I guess just in terms of the logistics of that, in the first rollout, you all had a federal allocation amount that you would receive, and then you had until the end of that week to direct where the doses the following week would go. If we're on a September 20th deadline, that would mean allocations for next week. So I'm just wondering, have requests been made? What preparations have been made for the possible rollout? And do we know anything about how many doses and where those doses will go? Will it be primary care providers, or will it be, as it was in the first rollout, primarily hospitals?
In staff meetings, I've been amazed at this precise work that this team has done to be ready for third shots when they are approved. One of the things that we know will be a little different this time is that a lot of people went to some of our high throughput areas like athletic stadiums and Friday Center and Chapel Hill. And so they may be thinking that those are the places to go to get third shots as well. And there probably won't be many, if any, of those this time. And we're going to be encouraging people to go to our pharmacies and other providers across the state. And yes, there is a plan as for specific numbers. Dr. Cohen, and you might want to elaborate on what I've said as well.
Thanks, Laura. So unlike earlier in the year in December and January when supply was extremely limited, as we look forward into the next few weeks in terms of boosters, supply is very different. So we do have a lot of supply here in the state. We are already making some projection planning and making sure our providers are ordering, but the ordering is not as tight nearly as it was back then. So supply is really not the issue. But I do want to reiterate what the governor said is I do think the access points are going to be different than what people saw when they got their first rounds of vaccines earlier in the year. So we're not anticipating, as the governor said, the higher throughput sites, because now we have built up a vaccine infrastructure where there are more access points, we have more supply. So we do intend to utilize those access points, our pharmacies, our primary care doctors, our public health departments. So that is where you're going to see us direct folks for their booster shot. Once again, we have to wait for the FDA and CDC to give us the go-ahead to do that. So anticipate more as we learn more about who is going to be eligible, what window of time since your last dose of the vaccine are you then eligible. So we still have a lot to learn. We're doing a lot of pre-planning. I would also say we know our hospitals are incredibly busy right now taking care of sick COVID patients, and we are planning to make sure that we don't strain them further with efforts around booster vaccination. So we're taking that all into account. Last thing I'll mention is in our long-term care settings. As you'll remember, the long-term care folks were given vaccinations through a federal program before. That will not happen this time. We are working on that right now to make sure that all of our long-term care facilities have a vaccinating partner. And the good news is that nearly all do. And so we are making sure that once boosters are available, that we have the ability to go into our long-term care facilities and administer those boosters as quickly as possible. Thanks very much.
Thanks everybody for joining us today. And if you haven't, get vaccinated.